here, and Yoram is a personal friend of mine. And I remember my brother, who was the doctor, and he told me, Steve, when you become a dentist, don't work on friends and family. And what happens is we work on friends and family. And what happens when you work on friends and family? You get the most complex cases. And this is actually interesting. This is one of the most complex fillings I've ever done. And we did it as conservatively as possible. And Yoram had a very rare condition called idiopathic decay, meaning the decay happened for a reason that we don't know. Just like some other bad disease might happen to a person. As worse as it gets in dentistry, it's idiopathic decay, where they get a big fat piece of decay in their tooth, and we got to fix it. And how did we find out about it is that he came in last week and he was complaining of some discomfort, a bad taste, some pain in the upper right side of his mouth. And we took an x-ray, and if we go over to the x-ray, we see the x-ray right here. We can see actually the big blob of decay, the big dark circle right next in the back of the tooth. So I said to myself, did Dr. Ingram miss that on any previous x-rays? And I reviewed his x-rays, and actually I didn't. So this is why we would term it as to determine that we would say, what do we call this? Idiopathic decay. As opposed to, let's say somebody eats sugar and they get decay, and well, that's because of the sugar. But in this case, there was no reason for him to get the decay. So you can see the big hole here, and we did a very hard job on him, and we actually did a filling on the tooth. And here's the filling. And you can see that it goes from the very base right here all the way up. We still took out the decay, and miraculously, for all you dentists and root canal specialists out there, we did not do a root canal on the tooth, as you can see. There's no root canal done on the tooth. I was very close to the nerve when I did the filling. The nerve was not exposed, but it was seen through the very thin saran wrap-like thickness of the tooth when I took out the decay, meaning when I look right in here with my scopes here, I can see the redness of the nerve through the thin tooth. So basically, we had to do some bone surgery here, cut away a block of bone, cut away that whole, all this gum that was in this area here. Gum actually grew into the space here, and then put what's called a matrix on the tooth and did the filling. And we told him we're going to send him on his way, and hopefully everything hopefully will be okay. We're not sure, but if we had to do a root canal on it, it's a very tricky root canal, and that's why I didn't want to initiate the root canal right away. So Yoram, how was your experience today?
My experience was excellent.
Excellent, yeah? Was everything explained to you in a forthright manner? And
you're a very knowledgeable dentist with a lot of experience. You like to explain your knowledge to the patient, and you're up to date with all the new technology and all the new techniques, and you're interested in. Yeah.
So we planned all that.
How many years am I coming to see you?
Well, first of all, how many years do we know each other? It's actually probably 51 years. Well, I'm 59, and Yoram's birthday is June 6th.
I'm June 5th.
June 5th. Oh, pretty close.
59, yes.
We're both 59. So, and we went to camp together in Lake Audie, Perth, Ontario, 1967. So
72 years ago.
Yeah, when we were single, and we went to Europe together.
I would hope we'd be single when we're 7.
No.
We were single. You said we were single on camp.
No, I don't know what I meant by that.
All right. Anyway,
but anyways,
whatever the case may be, you throughout, I probably have one of your first implants, right?
That's when I didn't know anything.
And you didn't know anything, and yet you did a good job.
It still came out.
It came out okay, and it's still there.
Right. And actually,
so there's
the implant. Actually, sorry folks out there. There's the implant that I did about 18, 19 years ago, and there's a filling that I did about 25 years ago, and actually. The combined, this is 20 years and this is 25 years, so let's say 45 years of dentistry.
Still kicking.
Still cooking, actually kicking very, very fine. But it just befuddles me to see how he got this idiopathic decay. That's
maybe from my stroke. Maybe something during the stroke. Like some of the drugs or something, maybe, I don't know.
You know, anything is possible, anything is possible. So, since we did such a super job.
See, I had a stroke a number of months ago and I look fine.
Yeah, it looks fine. So, Yoram, hold on. Yoram, don't get so relaxed.
Ring the bell.
You get to ring the bell. Let's set it up. It's been a little cantankerous lately, but okay, go ahead, Yoram.
Service?
It's good service, right? Good service. Another ring for our friendship.
There you go.
And I'm making a wedding soon.
Are you?
I'm making a wedding. You didn't know? I didn't tell you. Ellie's getting married,
Oh yeah, you did.
and we're expecting another grandchild.
That's every year.
That's it.